again have a power pack session with you all. This is late Thursday night. I know the whole week is going to be exhaustive, and still you all have joined me. It's really appreciating and encouraging also. So we as homeopaths have that zeal and courage to keep going ahead in spite of all the odds. Okay. Today, as you all know, I am Dr. Ruchi Jain. I am from Nagpur. Have been practicing predictive homeopathy since a very long time, and I've been conducting online sadhana series since 2020, which has become a mission of my life to carry forward homeopathy. And as we all are women's and we are enjoying the womanhood, we are on the platform of the Iconic Women's Homeopathy group all over the countries, and we are in India, Bharat. And as I pay the gratitude to bring me to this platform, and this is a second lecture, and previous lecture we had on the mature or preterm puberty, and today it's going to be ahead with all the hormonal issues and whatever crisis a female passes through. So it's a journey beyond the experience of being a woman, and a journey which started not only from the mother's womb, but becoming a mother on this world, on this earth, and keeping this as a blessings of your life. We have got that energy of becoming a mother. So from child to this motherhood, we are here with the Power Pack session, and my sharing to you is related to this case. In nowadays, we see so many cases coming up with PCOD. Do you all agree with me that nowadays, lot many women have started becoming infertile? Lot of females are losing their femininity. Do you all agree with me that this was not so common in the past golden days, where femininity was accepted, where the female enjoyed every role being given by the mother nature? And here we are going to discuss each and every crisis. So through a case which is being shortly presented to you, it's a very small case of a female who came to me with the problem of PCOD. See, there is a difference between PCOD and PCOS. I'm not here to describe you with all those things. And she presented with me was a menarche which started during December, 12 years of age. And then suddenly when she came to me, she said ki almost it has been 2 years that I did not have my cycle. So remember, can you feel the pain of a female at a very early age? You're not able to menstruate. Getting normal menses is such an essential part of your health, and you feel relieved when you have a normal and a natural cycle. And the anxiety it poses not only on the family, but the daughter who is suffering, the mother who is suffering, whose daughter is also suffering. Now we see even in generations it is running that mother had PCOD, and now the child is also suffering with the same kind of the disease. So this lady had a lot of hirsutism, lot of hair growth which was there, and she said it is so embarrassing that I need to shave it every alternate day. Otherwise the hirsutism is very bushy, especially on the neck side, and the whole lower part of the face was covered with the bushy hairs. And if she doesn't shave it, it is very horrible to see. She has been putting on weight tremendously because her cycles are not regular. And she has developed a lot of stretch marks also, with the prolactin levels which were very high, and even the DHES level, which is also very high, indicating that her adrenal, cortical, and hypothalamic system was very much stimulated. So she has been not suffering with a recent crisis of hormonal imbalance, but a very long crisis, maybe from the menarche. She said that she has got acne. She just hates her body because she doesn't look perfect like a female. So we can understand the pain of such females who are coming to us, that they are being born as female body, but not functionally. They are behaving like a female. So that is the crisis they pass through. She had undergone with lot of treatment. Even aldactone was given to her, lot of progesterone, estradiol was given to her. She had been dieting because she was just putting on weight. And mother was forcing her not to eat because of all the hormonal treatment. She was just continuously putting on her weight and becoming very flabby and fat. She had lumbar pains, which was excruciating, especially in the night, and they used to come before menses. And she said, nowadays, I really feel that I will get my menses, but not a single drop passes. One word this female told me, I really get amazed when the classmates of my class, they discuss they are having normal cycle. It becomes so exciting for me, and sometimes I feel jealous also. Ki, how come they have normal cycle and I don't have? So she used to abuse herself also. She also had constipation, because of which she was suffering with hemorrhoids, which is very common. As a short history, because we have a time constraint today, I would just brush you up that this female was born in a joint family, a typical Indian middle class family, where father was very strict, mother was very fastidious and very busy with the kids. She hardly had time to give to the daughter. And she was the eldest amongst all the siblings. She had younger two brothers more in her family. So this was the whole family situation, and a middle class Orthodox family, where the mother was fighting to have a male child. So here she says, ki, as a eldest daughter, I was very much disciplined by my mother and very much cooperative also. I never remember in my childhood that I retaliated to her. So because I always wanted a peace and harmonial relationship in the family, I always respected the family bonds. And since it was a joint family, my grannies were there, my chacha chachi was there, my buaji was there. So everyone was there in the family. So my mother was more responsible and caring towards her daily course. And being a child, I was really being neglected. And then when I was a child, I came to know that my mother is again having a baby. So that time I was really stuck up and not understanding what is my role to play. I had good bonds with my brother or the siblings. But the only thing is, because my mother was continuously busy with her work, and she was really so much preoccupied that she could not even give time to me. And I felt that when this is the age of me to get that love, I was not getting that love. And even my family members would not give me that love which I was seeking for. So I said, what would you do at that time? So she said, just stand in one corner looking at my mother and just seeing that when she will get time to give a hug to me, because I wanted that. And because there were so many family disputes and so many things which were happening around, everyone was behind me, criticizing me. And just I was being told that because your brother is born, your mother will not take care of you. So already I remember, I used to cry because mother is not giving me attention. And on the contrary, these people would tell me, you will not be taken care of. I was very much attached to my family. And at that time, I remember when her pubertal age was there, she said, ki, okay, I was good with responsibility. I was taking care of the family very well. But when the separation came up, I was very much attached to the family relationship, to the home we were living into. And I was so much attached that I used to weep alone when we were getting separated. I was so much attached to that home. I was so much occupied with that home that taking me away, even today, brings shudders in my life, because that is the attachment I had. But whatever emotions I had, I could hardly express in my life. Today, even I knew to crack this case, lots of effort was required because she was not ready to open up. She was not ready to express her emotions. She was a loner always. She said, "Ki, because I was too occupied at home with the responsibilities, taking care, and I took over that responsibility being the elder daughter. So I became a loner gradually. So I would just sit with my books, read them, and just stay away from the limelight. And I remember because I always looked slightly elder to my age, so I was being bullied by my friends. Would always feel shy and embarrassed in their position. My best friend also moved away when I was in second standard. I remember that situation because for me, relationships were so important. And getting separated was really a shock for me. So getting away from that limelight was something which I used to do. And I would never participate in any arguments in the school. I was always a shy fellow and never participated in any other activity because I could not argue with anyone. That would hurt me. But even after being hurt, I remember from my early childhood, I would never have that courage to cry also. Even today, even though I am very sad, I cannot express my grief and sorrow. I was just a simple girl, a Benji type, you can say. And that is why I was being teased. Maybe, probably, I did not understand the sense of what is there as a makeup or carrying myself. I did not have that sense. And I don't remember that my mother also took that responsibility of preparing me or cuddling me. Okay. So this was the state. As a girl, she was very hardworking, morally a very good girl. Oh, very good in intelligence, but she said I was slightly poor in calculations and my intellect was good. So I was very hardworking with a perseverance that I would do something good in my life. I had been very honest and a very disciplined girl all throughout my life. So, if you remember me, if you remind me of my childhood, I was very hardworking and very studious, would never miss my school. And I don't remember my teacher posing me any anger or showing me dissatisfaction because that is what was not expected from me. And everyone said, "Ki, yes, I am a very good girl." Uh, so this was the whole family situation. So as you all know, this is a PCOD case. And in PCOD, the most important thing is how the hormones they get disbalanced and how it affects the identity of the female. Because the female is born to take care. The early responsibility to grow faster because I have to support my mother. I am lonely and I have to take care for others. So she is a female who is responsible and looks very mature to her age. She's conscious of her physical appearance. She feels ugly and embarrassed about her looks. She cannot show her weakness to others and cannot even read though she's sad. I'm insecure with fear of separation and that grief of being separated from my family, from my loved ones, has been already there into my heart. I always had to suppress my anger because being timid, she could not express her anger anywhere. She was bullied, she was being teased, everything happened, but she could not take it to her heart. Pressure was always there that I have to prove myself because that is the only way where I will get appreciation. She also shared one experience of her life that there was already a pressure of giving perfect results so that I would get appreciation. So for me, always it mattered was my position in the class. So I always tried to beat up the position and always stood first in the class. So here, if you summarize what is PCOD, you saw in this case was the DHEAs which is disturbed, the cysts which are forming, there is a lot of hirsutism, and there is prolactin which is being disturbed. And above all, there is something which is coming up as a precocity into herself in her behavior. So what are DHEAs level? Just brush up in few minutes. So they are released from the adrenals and they are released as a result of the stress mechanism which we have. So because of DHEAs which are being very high, she was always on the fight mode. She had to always fight for her survival. So she was always fighting. I think someone's audio is on. Can you please mute yourself? There is a voice which is coming out from the backside. Okay, thank you. So precocity has been always there. She would work more so that she could prove herself. So there was a constant pressure of performance. She had to be very competitive and sensitive also, that because I have to prove myself so that no one criticizes me, so that the need was that I should be appreciated and be loved. Why the cyst form? Cyst is a form of insecurity. She was being separated from the mother at a very early age. She said that my mother was already occupied with work and then the sibling came. But there was no expression of jealousy. She just said, yeah, I was waiting for my mother to just give me love. So there was separation, there was grief, there was being frozen, forsaken feeling which was running here and there. Now, the cyst is a form of insecurity. It is shielding up. When does the cyst form? A cyst forms when the ovaries, they don't release themselves into the fallopian tube. So they just form a shell around. They protect. It's a protection. Water comes to protect because this ovum fails to get out of this ovary. Now, the prolactin levels. So prolactin is a hormone which is released when a mother nurtures the child. It's a hormone responsible for the motherhood. So this girl had to pass her motherhood cycle at a very early age. So she wants to nurture her younger siblings just like the mother. She was very caring. She would help her mother in daily chores. So she became motherly at a very early age. So this motherly instinct is responsible for giving you higher prolactin levels. Now come to hirsutism. So what was happening and why this hirsutism came? So it's a very huge story. We know this is a balance between the male and the female parts of the masculinity and the feminine. So there was a lot of embarrassment which was there. She was always suffering with insecurity. And when the adrenals are stimulated, she was actually being forced to go into a pituitary, hypothyroid, and ovarian section which was getting disturbed. So lot of masculinity had to come because she had to prove to the world that yes, I am capable enough and I'm worth enough to be loved by my parents and to be accepted. Because she was not accepted in the friend circle, there was so much odd man out situation. So she would love to dress like a person who was just not being exposed or not into limelight. She started behaving like her younger brother so that she also gets accepted. So all these features gave you all the symptoms of PCOD. So she had PCOD, she has obesity. She was chilly before, now hot, thirstless, sun, aggravation which was there. So it's a pathological disease at a structural level. But sensitivity and susceptibility of the patients are very good. She has got a good immune status. Okay, so the totality which here comes up is definitely she's a reserved and introvert person. She was mature enough, but definitely accepting to the situation. Nowhere she was showing her obstinacy or demands in the life. She was very mild and a quiet lady who was accepting what were happening, and she had that aversion to fight. She wanted harmony. So therefore, she became servile and very obedient child. She was very responsible from a very early age, though she was not being demanded, but still she took over the responsibility very well. She had grief, silent grief, though she could not cry in that grief with sadness. And she was a lady who was sensitive to criticism. Anger, because it was not expressed, weeping alone, and cannot weep, though sad. She said, I always had that need of love and being accepted. So I just brushed up this case and we recognized. So the remedies which were coming up were carcinosin, ignatia, lycopodium, naxwamica, pulsatilla, and natramine. Going ahead with the remedial differentiation, there are people who came up with carcinosin. I should appreciate them because carcinosin was really coming to my mind over here. Then how will you differentiate this remedy? Can you anyone take an effort and put it in the chat box? Apart from carcinosin, ignatia, has anyone thought of another remedy or any PQRS which you have thought can be a prescribing totality for this case? And how would you have handled this case, emotionally churning the patient and handling the case? So you can feel free to have a discussion in this case. And as we all know, if you see, so many remedies are there about here. Okay. So if you have thought of magnesium, why magnesium? Why did you think of ignatia? We'll take this in the discussion now. So if you go back and discuss about sepia, how will a sepia behave in such totality or in such situation? So always remember, sir would always say, the sora of the remedy and sora of the individual is very important. So if the mother had really been very strict, if the mother would have been indifferent to the child, then sepia would have come up. Sepia could have thought of when there is lot of indifference in the mother. When the girl says, I just hate being a female. I just hate being responsibility of my family. Now I'm too tired and weaned off because of all the energies I have put in my life. In early childhood, sepia is very bubbly. Sepia loves dancing. Sepia as an individual in early childhood loves that femininity part. That indifference comes in the syphilitic end, not in the sora. So I would rule out sepia in this case. Then phosphorus. So phosphorus definitely an extrovert, bubbly, loving affection, showing love because it needs love. So this child was definitely an introvert child. Going to acid phos. If you think of acid phos, what will you think at this stage of acid phos? Then the first thing which will come in acid phos is the wind of disappointment. Acid phos is a very beautiful remedy acting upon for disappointment and deception when they are very recent, not of the past, and draining out the energy since it is an acid group. Then natramure. Natramure personally was a very well indicated remedy in this group, in this whole case. But natramure, as we all know, is an introvert and a non-diligent person. But this patient is absolutely a diligent. So we can think of a diligent natram. So natram arts, natram car, they all come into the picture. Yes, natram also has got that grief in her heart, which cannot be expressed, and forming bonds, which is very important for natramure. Natramure is very sensitive to breaking of these bonds. Pulsatilla will cry while narrating the symptom, but that person somewhere was showing that she had a strong willpower because from early age she understood her own responsibility and played all the roles very well. When a student, she was a very good student. As a daughter, she was a perfect daughter. Naxwamika, definitely not an angry remedy. Lycopodium, if you rule out lycopodium, how will you understand This case in lycopodium, or is she manipulative? Is she a individual in Sore where she was very timid? Yes, she was a timid lady, but she had that courage to fight to her situation. She had that responsibility sense which was there. And she was never behaving two different ways, like manipulating. No, it is absolutely not there. So the other remedies which can be thought of is Ignatia, Carcinosin, and Natrum Carb. Three remedies are coming up. If you think of carcinosin as an evolution of PCOD, how will you think how a carcinosin will behave in a family? Carcinosin will have a very strict parenting. So was it a strict parenting or it was a forsaken feeling? Can you give me in the chat box? It was forsaken feeling more or a strict parenting which is more? Is it domination more or is it neglection more? Yes, it was more of forsaken feeling. Therefore, magnesium also came up in this group. And this is where she starts feeling that she was not molding herself because someone was hitting her. We know that carcinosin is called as bonsai. If you understand the soul of carcinosin, you will understand that because they are so much being demanded by others, that because they are weak-willed person, carcinosin is very weak-willed. It doesn't give his opinion. He has to bend up because there is no other way out. I have to give up to the situation and behave whatever my parents are demanding from me. I cannot have the courage to just revolt and rebel at that early childhood. So they try to just adapt what is being told and guided by to them. Okay. Then if you see, go ahead and see how they react to the situation. So they are very sensitive to rudeness, definitely. They get offended very easily, but still they have to just take and bear all the grief they have in their heart. Okay. Then you will understand Natrum Carb. Natrum Carb came very close to me when I was differentiating this remedy, because Natrum Carb is also a very diligent, very sober girl and very much selfless in her life. If you will see the rubric selfless, you will see Natrum Carb is standing over there in trees, because yes, Natrum Carb will have despair in her life because she was being estranged from the family. She has fear of males and dread for being injured by them. So she doesn't have that courage to fight again a timid remedy, but she develops in syphilitic phase, or in that whole phase is misanthropy. That is aversion to the whole society. When she's being hurt, she's being offended, she just goes into the shell and she starts, like, if a Natrum Carb in love, in affair, if you will see Natrum Carb, if a Natrum Carb is hurt by the boyfriend, what will a Natrum Carb do? A Natrum Carb will definitely not fall into a relationship very easily. She will hold on the grief which she had from the disappointment of love in the past. And she will say, my love was with that person. That is what Natrum group stands for. But Natrum Carb especially has got fear of males. Because of being offended once in their life, they go into despair, they lose the hope into relationship. Here we were not finding this. What we were seeing is she was missing her family. She was missing those bonds with her family. She was standing out, not demanding to the mother, not even asking her, Ki Mama, please take me also close by. I also need that love. She did not even demand her grannies, and she was behaving so well that I should not be criticized. In school also, she was a very obedient girl, a very sensitive female. Because she was very sensitive, she could perceive the whole situation in the family. She always desired that there should be a harmonious relationship. And homesickness, if you see the rubric of Ignatia, it is not always that the person has to stay away from the home. reach the delusional level, if you will understand, Ignatia feels that they are being kicked away from their whole family. They feel lonely, though they are in the home. It's a great contradictory remedy. Though they are in the home, still they feel that they are homesick. Though they have got good relationship and bond, they miss that relationship in the family. They have so much of contradiction. Therefore, they desire appreciation, but they are sensitive to criticism equally. And they are very sensitive to the position. So they are very conscientious, very diligent, and also a very good oral remedy. So this was being seen. A good reader. See, book reading is a quality which is required by a person who can enjoy the loneliness. A person who's too social will never sit in a corner and read a book. That also gives you a disposition level of the personality. So after this differentiation, can you come up with a final remedy to be prescribed to this patient? And let's go ahead with the follow-ups as a quick brush up. When the remedy was released, her remedy was Ignatia. Okay. Magnesium, if you see, magnesium has got its own evolution. Magnesium is also always a non-complaining, a non-personality who will never trouble, but they have an orphanage feeling. Here, the feeling was not orphanage. The feeling was of not being loved. Okay. Orphanage feeling and not being loved is somewhere where we need to differentiate between magnesium and Ignatia. Magnesium, sir says, is a very contented remedy. A very contented remedy would not. They are, if you go into an orphan and see the kids over there, they're happy in their own places. They have never experienced the love of parents, so they don't even know how to express that love or that devoid love in life. So they will never ever tell you ki, oh, I never had love in my life. I was so alone. Later on in the life, they will understand ki, oh, parenting is like this. You can have parents who love you like this. Oh my God. But Ignatia exactly had parents. It was not orphanage feeling. So therefore, magnesium was ruled out in this case. And diligence also. Ignatia is more diligent and more sensitive. Even magnesium is sensitive with milk aggravation, which is there. So magnesium from so early childhood is being rejected by the parents that magnesium cannot even tolerate mother's milk and the other's milk because the craving for love is there, but that is also suppressed in magnesium. Okay. So yes, after giving the right remedy, her flow started. She had profuse menses after such a long time. Constipation, which was better before, was aggravated after before menses. Again, you will see she did not have menses for such a long time, and after giving the right remedy, her menses started with the flow of proper constipation, which was better. It is starting getting better, and I will tell you, when you see such cases, I have noticed that yes, we need frequent repetition. I repeated Ignatia when menses did not come again after 5 months. After medicine, she was very happy. She started menstruating so well. And she said, after such a long time, doctor, I do not need alternate shaving. My chin hair have started becoming soft. This is a very good indication. If the lady says, the I say hair are really visible, but these hair have started getting softer. They have not become very bushy. I can see that now the scarcity is there. Few hairs grow now. The frequency of hair growth has reduced. And the amazed was, since a very long time, she was dieting, she was following everything, still weight was not coming down. Her weight started falling down. So if in a case, if you see that the weight has started reducing, the femininity starts appearing. The girl who was so mannish started enjoying, I told her, now start enjoying her femininity. I had to undergo definitely few sessions with her where I explained to her the conflicts of femininity, what she was passing through, and her desire to prove herself. So she had to accept that, yes, I'm doing my best. That self-awareness in these cases help a lot. So this individualistic understanding and importance of this femininity was well proven in this case. I could understand the role of a female, not only in the later ages, but also a femininity, that feminine characters start very early in the childhood, where you see a girl enjoys being a female by playing with the dolls, whereas a male is very masculine. So even playing the games can you indicate to you what roles this girl will play in the future. A girl who is very feminine likes to get makeup. So please, if your girl is demanding to wear a sari, a dupatta, or to play with the doll, don't just snatch that doll from the hand of that little baby who is trying to be feminine at that time, because that is the requirement of the budding seed and growing tree as a wonderful female of the future. So that is where the PCOD has to be treated, not when it develops full blown, but where the seed starts growing. So the seed starts growing very early in the childhood at the pubertal age. As we all know, the ovaries have got a fixed cycle. Your oomphogenesis is fixed. That stimulus is not later on. We saw in the pubertal age, when the puberty starts, when the first sign of puberty starts, how you handle that daughter. Please handle with delicacy, handle that daughter with care, and you will see that these phases of your menses are very important to be handled in a proper way. How we behave during our menses, how we handle the whole generation which is coming in front of us. So we are trying to balance between the universe which has given us the masculine and the feminine energy which is within us. We have equal hormones of testosterone also and estrogen and progesterone also, but we are feminine. We are the energy who is required to care and nurture and nourish the energy. And we are not supposed to be masculine. But today's world, we are missing that femininity in most of the females. We are missing the qualities of being intuition, nurturing, healing. A female doesn't want to be a female, right? So this is where we are lacking behind. We have to balance between the nar and nari, which is there. In PCOS, what happens is this hormonal imbalance occurs and the androgens, they get activated because it's a fight mode by the body. I have to fight the world like my better half does. I am not less than a male. All these crises lead to femininity crisis. Okay. So in every case where you see androgens which are disturbed, that is more of masculinity will come up. Insulin level which are increased, that means there is more of obesity which is coming up. So lot of insecurity which is coming up. Okay. If you see ovulatory dysfunctions in these cases in PCOD, this will land up future may into infertility or anovulatory cycle. So this ovulatory dysfunction has to be understood through AMH. Okay, so whenever you are doing a hormonal profile of a female with PCOD, please assess what are her DHEA level, that is her cortisol level, and also her testosterone level, her insulin level, that is fasting sugars should be done, her LH and FSH should be done with AMH. So if AMH is very low, that means the girl is landing up into premature ovarian failures, which is very important to understand that therefore she is going into anovulatory cycle and future infertility will develop. If it is androgen excess, you know she is fighting to her own self, to her own identity, dislike, being under so much stress and pressure. So if you see a girl who is so much into complication, help her out. If it is insulin and resistance, it is not always that she doesn't want to lose weight. If you will see these females, they are really fighting hard. Ma'am, I work out, I hardly eat anything, but still I put on weight. So this insulin resistance is an indication. This pigmentation around the neck in early females, if you will see in girls, please tell them that you have to be now very conscious about losing your weight, because all the conflicts which are they are carrying from the early childhood is getting transformed into the disease. Okay, this balance between a femininity and the masculinity has to be well maintained from a very early childhood. Appreciation is very important. Loving yourself is very important. So the symptoms are reflection of the mind. So if you have hirsutism, go to the androgens. If you have infertility, go to ovum. If you have obesity, go to insecurity, the liver crisis. Okay. So nothing is beyond miasm. If we consider miasm in homeopathy, especially in PCOD disease, you will see everything starts from sora. So the basic need which has been compromised shifts the gear from sora to psychosis to syphilis. And when this female loses her complete identity and becomes masculine, starts having no roles of being female, is the extreme syphilitic phase. So according to the miasm, you have to understand what rubrics are to be picked up. Let's brush up in short. Like if ovarian conflicts are coming, that conflict will give you identity conflict. The girl is fighting to be a female. The motherhood crisis, the family environment is too stressful for her. The mother is being demanded to give birth to the male child. This is very important crisis which is there in early pregnancy period, where the mother was being tortured that I demand a male child. So she gives a female having male hormones. Okay. So precious thing which is there in your life, but she misses this valuable part of the life and goes into ovarian dysfunction. So this is definitely psychosyphilis. So ovarian dysfunctions are needed to be taken care. Now, if a PCOD comes to you primarily, that is from a very early age of menses. Her symptoms had started when puberty struck her. Go and search for the pregnancy history of the mother. Was she having some crisis during her pregnancy? Was she having primary infertility, delayed menarche, all these primary amenorrhea? This needs to be inquired about the mother, how her whole pregnancy had undergone. I'm not going into details of this. You can get into my channel and you can see the detailed videos which we have shared. You will get these links over there. Okay, but ovaries fail to mature. See, one phase is where the ovaries are not functioning absolutely, anovulation, right? Even ovarian dysgenesis, ovarian agenesis, uterine agenesis, all these problems are really a syphilitic phase of the life. So go and see the femininity crisis at that level over the identity part. Ovaries fail to mature. Okay, the insecurity. I'm not ready to come out. I'm too small. I'm immature. I like my identity. I have been sexually discriminated in the family. All these insecurity goes into the mind of the child, and the child says, I'm too obstinate. Now I will behave just what I want to. They become resistant to the LH and FSH, and therefore they do not ovulate. They have that fear that I am not prepared to go into the outer world. I might get injured. So I fill myself with water. I have lack of confidence. I have anticipatory anxiety. I cannot face the world. They are coward females. Okay. Childhood memories, bad memories, they just haunt them when they are alone. In PCOD cases, don't take the surface iceberg. Go deep, 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 deep. It takes really, when it becomes very tough, the cysts are polycystic, arranged into the periphery, bigger in sizes. The insecurity is not on the surface. Simple remedies don't work. Okay? You have to go and search the SORA. That is the early childhood, which has to be kept into mind. You can take the specific rubric when it comes to cyst, like tumors, general cyst. You see the remedies like baritas, calcareas, carbons, carcinosin, they are coming up because they are very timid in the childhood. They don't want to come out of the shell. Another remedy, graphitis, is also one of the timid series. Sepia silicia, they are also a good remedy for cyst. You will take into notice that natramur, because muraticum, they are lean thin. So PCOD, when it comes to obese people, don't think of natramur. But if you find PCOD in lean thin people with long neck, then think of natramur. It has to match the totality. Don't just blindly prescribe on the basis of a cyst. You see what is the reason of this insecurity. There is a rubric called as tumor general ovaries. You will see maximum remedies are coming over here. But you will hardly find, for my amaze was that natramur is not coming here. And everyone, we came to natramur for that case. We were thinking of natramur in that case. Okay. Even you don't find ignatia over here. You don't find remedies like sulfur also over here. But these remedies do work in our cases. Okay. EPIS is indicated when you see a workaholic women. You see a lot of insecurities, jealousies, comparison, rebellious nature, very want to be sexually attractive but doesn't have, nymphomanic, so many things are coming up. So ophidias do come over here. Okay. Because of being into this femininity crisis, they feel that they have got a heightened ego, and that blighted ego gives you the remedy like platinum, because they feel they're the best in the world. They are queen of this world, and they hardly bend down to their knees and adapt whatever is being given in the situation of their life. So you see revolting and rebellious remedies which are coming over here. You see acids, folate acid, very aggressive, very corrosive, which is there. Okay. I don't have an experience of giving specific remedies like folliculinum or ovarianum. If someone has, they can definitely share. I saw in the group that yes, people are giving in the cycles, but we never prescribe. So a lot of baritas are coming over here. Why barita and calcareas come? Because they have got that cyst tendency. So if you see cyst, you see overgrowth, think of barita and calcarea, and if it matches, you will crack the case very beautifully. Okay, so again, coming to insecurity, which comes because of neglection, being forsaken, hatred, and insecurity because they want harmony in the family. They want that everyone should love them. They want to mature themselves very fast, or either they don't want to get mature enough because they don't want to be dependent on the others. They want to be independent. But because they are helpless, you will see two sides of PCOD. One which is very timid, the other which is very bold. You see calcarea and barita in the group, and equally you are seeing palladium and platinum also in the series. So just because it is a cystic lady, ovaries which are polycystic and hefty, just don't prescribe calcarea and barita looking at them. See what crisis they have. The confidence lack of, childish behavior, cowardice. So this is where they don't want to mature in the past. So they have that insecurity. So calcarea group stands over here. Barita stands over here. Your carbons come over here. CarboH, one of a very beautiful remedy for identity errors. Okay. So identity, self, when it comes. So all the ovarian crisis will give you identity crisis. They have a confusion. Though I am a female, but I am being demanded to behave a male. So they become tomboyish. Okay. So they have that duality sensation. I am a male, or I am a female. They have that personality errors. If you see an effeminate female, take this rubric and prescribe on that self. Okay, you will get the remedy out. I have prescribed on these bases for antagonism or self with beautiful results have come up. Manage habits of girl, a small rubric, but yes, it has given the remedies. Just don't take that rubric alone. Match the disposition. Effeminate, again, an identity crisis. I don't want to procreate in my life, so I don't want to get married. Aversion to marriage, aversion to taking male acceptance in the life. Okay, they try to compare themselves with others, so they become very ambitious, over competitive. They want to be independent. See, we saw insecurity. There was a shade of insecurity. When we see identity crisis, you see that girls try to compete the today's world. So they feel they have libertinism desire. They cannot tolerate injustice. How can you discriminate between male and female? They have aversion to family responsibility. They want that their husband should work like a female and I will go out and work in the outer world. So they show indifference to the daily chores also. They don't want to get married just because they don't want these responsibilities. So you see in managed habits of girls, you see Carbo-Veg, Simicifuga, a very beautiful remedy, a hysterical group of remedy which is coming up. If you will see Simicifuga, it has got a very clear indication of hystero, utero, and muscular combination, where everything is hysteria. Even the joint pains are hysterical. One part of joint will affected and the other part is affected. Okay, so remedies come over here which are hysterical. Think of Simicifuga. Think of Kali Brome when there is lot of delusions which are coming. If being neglected by the family, Palladium is there because she wants appreciation. The neglection of Palladium is not that 4-second feeling of magnesium. Palladium wants that I am doing my best performance, so you appreciate, want to be flattered. That is Palladium. And when you don't appreciate, they feel neglected. Wow, wow, wow. You got a prize, I should clap for you. That is what a Palladium wants, because Palladium is the highest metal which needs recognition. Okay, most expensive. You have pulsatilla, a sobbing, weeping, innocent girl, always crying. Okay. Then, if you see the rubric confusion identity, you will see over here that, as I said before, it is identity confusion because of the pressure of the family, of the society, that I have to prove myself, I have to perform myself as a female. So all these rubrics can be well differentiated through the case taking and can be prescribed. Identity errors of, you will see the remedies like androctonus, lac caninum, Kali Brome, so much of delusion in lactan and Kali Brome, but they become aggressive and angry. They are not timid people. In identity errors of, you will hardly see timidity over here. You will see is more of aggression, more of anger, more of hysteria. You see hysterical remedies like stramonium, Kali Brome, laccan, they all are coming in the series. The king of hysteria, even Moscus. Okay, that is there here. So you lose the personality and you behave very weird, and you even don't know what you are born with by the mother nature. And therefore, the remedies like Lidium Day, cannabis sativa, all hysterical remedies are over here in this group. Okay, so giving ovarian crisis, they are being blamed of not getting conception. They go into that false pregnancies, pseudo pregnancies, all they will come under identity errors of. Okay, antagonism with self, again an identity crisis. Okay, children aversion to her own, where they don't like children. So I never want children in my life because I just hate them. You see platina over here, you see phosphorus also coming over here, but this phosphorus and chocolate, again, a chocolate is a verbose remedy, a loquacious remedy who will talk, who will just attract. I have seen today, in today's world, people crave lot of coffee and lot of chocolates. There have been so much coffee desire in today's world. Okay. Responsibility aversion, medorinum, a very beautiful antipsychotic remedy which gives wonderful results in infertility. I have tried cases where in medorinum I saw that the patients had torch positive where a nosode was indicated, and there she conceived after giving medorinum. Okay. Again, you have so many things. Another case I had was a female, again an natrum card case, which was there. I wanted to differentiate between natrum card and the presentation. But I think we should take up the question asked. So from the whole series, from the lecture today, I understand is acceptance of yourself as being born as a mother, as a female, and even giving this to the next generation, girls, to adapt and balance their healthy life and love themselves is very essential. And the role of healthy relationship, not only with yourself, but also the family and friends around, and definitely a healthy lifestyle and adapting to a feminine lifestyle, I would say, rather than yoga and lifestyle, I would say a feminine lifestyle where you cuddle yourself, you dress yourself, you love yourself becomes so essential, and your own identity of femininity becomes an important thing. So this is the whole session today. I know it was a slightly faster. If you have not understood, we can go back. Thank you. Get back to Dr. Alka. If any queries, I can take.
It was a wonderful presentation and wonderful insight into differentiation between various remedies. Certainly, it is useful for the entire group. And I'm sure there must be questions from the audience. So, anybody wanting to ask questions, please type in the message box, or you can just raise your hand and ask your question.
Good evening.
Yes.
Good evening,
Yes.
Dr. Ruchi. Myself, Dr. Rekha Srinivasan. Actually, so the way you have put everything, no, that is very, very like essential. Rather than going for just cases and discussing remedies, this is the way I feel you have given the right knowledge to us, and it's really wonderful. And I want to know little more about this identity, this thing, gender identity. Like, is it like? Did you see any cases like where girls who want to be like boys turn normal, like after treatment? Yeah.
I have treated cases not only from the elderly, but I had a case in a very early childhood. That daughter came to me and she was belonging to a Muslim family, and they were amongst the three females, right? So she would always say, Ki, Mama, I don't want to wear these earrings. And you know how this pressure is upon the girls that you have to dress up in a certain way. And this female would just reject and she would just prefer wearing pant and shorts. And after giving a right remedy, because I went there also to an effeminate and a manish, because though she was very small, and over a period of time, when her mother said, Ki, now my daughter has started even enjoying playing with the dolls, which was not there before. So yes, it has come up. And even one case I remember, there are so many cases in the list, but yes, I do remember one of my case where the girl would say, Ki, I would hardly recognize her because she already had that hair do like a maid. And in that case, I gave her palladium because her father was into IPL, and she would always behave like her father, and she was amongst those players. So she would always love playing cricket, and she would say, I want to become a cricketer. But because she was not accepted there, my father was handling male part, palladium helped her a lot. And she started having a normal menstrual cycle. I have so many cases where I have really used this identity rubric antagonism wherever the ovary. But see, the most precise thing is be scientific,
Yes.
be very loyal, and
Yes.
take help of the investigation.
Yes.
If it is see this slide, if you remember,
Hmm.
I have already mentioned ki if it is androgens,
Yes.
then hirsutism will come up. So if androgens are going very high, then correlate with that part. Don't just pick up a rubric unnecessarily because it is from the PC. If prolactin is there, then androgens will not go so high. Okay. Then it has to be more of nurturing and motherly care. So 4 second rubric will come over here. But if it is cis, more of insecurity. So you have to understand with the help of pathology what rubric has to come up in which case. So if you're a doctor, a homeopath, investigations and pathological correlations become very essential of your part.
Excellent, excellent. Actually, I have seen such cases, male, female, both, like identity crisis. But I want to know the like how much it is in homeopathy practice in general. So that's why I asked. Very
We
nice.
have got results. We
Yes.
have got results.
Yes, very good. Thank you.
Any other question? Can we?
Yes, yesterday I had taken up one case of infertility wherein uh, the female was had a history or a bad childhood, and she had a history of sexual abuse, a lot of insecurity. Even now in her present life, she is facing vaginismus because
Yeah.
she has trust issues, and she has been referred to me for this vaginismus issue. And I certainly have got clues to how I could solve the case just by listening to your lecture. So thank you so much
What
for
will be
the
the
wonderful
rubric,
session.
Dr. Alka? What will be the rubric you will select for this case? See, it's so beautifully you have given. Because if, see, what body doesn't like, if she has vaginismus, means she doesn't want anyone to penetrate inside because her past memories have been so painful about sexuality that this she cannot take it out. And vaginismus is not a pathology, it's a psychopathological correlation which is to be made in cases. I had one case of this, and where I came to know that her cousin used to abuse her and she was being frequently abused. So there is a rubric dwells on past. And one more thing is, bad news or bad events don't go out of the mind. Okay, so they go into continuous nurturing, and that wound which was there in the past is never healed in today's life also. So they don't trust anyone because they are being, because girl is first sexually abused is at home, so she is being assaulted at home. So that gives her that vaginismus. Now I cannot allow anyone to enter and I cannot trust anyone. Okay. So she had been a very, I can tell you that she's a very fearful girl, very fearful and a timid girl.
Yes.
She's
So
absorbed all the
she
pain
has
in her.
insecurity issues also. And somehow, after going through the entire case, I felt she fits into the Calcarea group because there's need for security and shielding herself, going into a protective state is something that she's always wanting to. Okay, and there is a lot
She's,
of
and
fear.
even now, she's dwelling on her past disagreeable moments of her life because she doesn't
Yes.
want to come out of it. She's continuously
Yes.
brooding. Okay.
Yes. So, ma'am, I would be discussing this case with you later on, as in how I solve it, and certainly I have learned a lot out of this lecture. I'm sure the others also have. Thank you so much for being there for us. Thank you, audience, for being here. And there are few more questions. I would request you to put down those questions in the group because we are a little out of time today. Yes, ma'am, I
Yes,
request you
definitely.
to please answer the questions in the group, in the
Yes, I'll do
IWHB
that.
group. Yes,
But it should
thank you
come in
so
the
much,
group. I'll
everyone.
Thank you.
Yes, good night. Meet you for the
Thanks.
next session. Bye bye.